Hello, my name is Dorothy Suku. Today I'm going to present on type 2 diabetes among Hispanic or Latino in the United States. Type 2 diabetes is a chronic condition that occurs when the cells or beta cells in the body do not respond to the insulin levels, known as insulin resistance. Insulin is a hormone produced by pancreas that helps to regulate blood sugar levels in the body. When insulin resistance occurs, the blood sugar levels rise, which leads to type 2 diabetes. Having high blood sugar levels can lead to other serious health conditions such as obesity, kidney disease, heart disease, vision loss, and so forth. Type 2 diabetes is often present with mild symptoms that can be unnoticeable by the people experiencing it. Some of the most common symptoms of type 2 diabetes are feeling very thirsty, feeling very hungry, frequent urination, blurry vision, numbness or tingling on hands and feet, and unhealed wounds, and frequent infections. Type 2 diabetes can be diagnosed by performing 3 screening tests, which are fasting plasma glucose or FPG, a A1C test, and oral glucose tolerance test. Fasting plasma glucose test is done by testing the blood glucose levels after 8 hours of fasting. The A1C test is done by taking the average level of blood glucose over the past 2 or 3 months. Lastly, is the oral glucose tolerance test that is performed by testing the blood sugar before and 2 hours after drinking a special sweet drink. According to the American Diabetes Association, to be considered diabetic, the blood test results should either show fasting plasma glucose greater than or equal to 126 milligram per deciliter, A1C levels of 6.5% or higher, and blood sugar levels of greater than or equal to 200 milligram per deciliter after the oral glucose tolerance test. American Diabetes suggests the first treatment of type 2 diabetes to be weight loss, meal planning, and exercise. If the blood sugar levels are still high, the patient is to be initiated with oral medications that lower blood sugar. However, patients with type 2 diabetes may be initiated with insulin use if their blood sugar is not controlled by oral medication. Other available treatments of type 2 diabetes are the non-insulin injectable that help the body to release its own insulin, such as Victoza, Trulicity, and Tansium, and so forth. Hispanic or Latino are the largest minority group in the United States that make up 18.5% of the US total population. Amongst adults in the United States, Hispanic Latino adults have more than 50% chance of developing type 2 diabetes at a younger age. There are several factors among this population that put them at risk of developing type 2 diabetes. Although genetic factors remains to be unclear, the consumption of food that are high in fat and calories and lack of physical activity considered to be the leading cause of obesity that eventually leads to type 2 diabetes. Additional risk factors that contributes to high prevalence of type 2 diabetes among Hispanic or Latino population are acculturation and obesity. Hispanic population tend to have frequent cultural events that include unhealthy foods with high carbohydrates and high saturated fat. Obesity can cause insulin resistance due to extra fat around the middle section of the body that causes the beta cells in the pancreas not to respond to the blood sugar levels. According to CDC statistics of 2015 to 2018, Hispanic or Latino who were considered to have obesity were 44.8 men and age 20 and over, and 46.8% women age 20 and over. National Diabetes Statistics Report 2020 of the United States reports estimated crude prevalence of diagnosed diabetes among Hispanic adults age 18 years and older in 2013 to 2016, with 95% cumulative incidence to be 10.3, and undiagnosed diabetes percent of 3.5, which is with a total diabetes percentage of 14.7. In 2018, estimated number of Hispanics who were diagnosed with diabetes were 4.9 million, and those with undiagnosed diabetes were 1.5 million, with a total of 6.4 million cases of diabetes among this population. The age-adjusted data for 2017 to 2018 shows that prevalence of diagnosed diabetes among Hispanic was 12.5%, second to the highest of 14.7% among American Indian and Alaskan Native. Prevalence data from 2016 to 2018 indicates an increase of type 2 diabetes prevalence among the Hispanic Latino population by 2%. Hence, type 2 diabetes remains to be a growing condition among this population. The estimated crude incidence of diagnosed diabetes among Hispanic adults age 18 years and older from 2017 to 2018 data was 9.0 per 1,000. The mortality rate of the type 2 diabetes among Hispanic or Latino in the United States between 1999 and 2016 shows the total of 31,000 deaths out of the total population of over 800 million. As you can see, the chart indicates more deaths reported in the West region of the United States, most likely due to the largest number of Hispanic population in Los Angeles County of California. According to the US Census Bureau in 2019, Hispanic population was 48.5% of the total population in California. The findings from the Diabetes Remission Clinical Trial, or DIRECT, supported the hypothesis that type 2 diabetes can be on remission through dietary changes and weight management programs. Hence, it was confirmed that type 2 diabetes of up to 6 years duration is not considered as a chronic or lifelong disease. The recorded diabetes remission among the innovation group from the direct study was 46% compared to 4% in the control group, with odds ratio of 19.7% and 95% cumulative incidence of 7.8 to 49.8. At 12 months of the study, 74% of the participants in the innovation group were no more taking anti-diabetic medication, and mean A1C was 6.4%. Compared to the control group, the participants who were no more taking anti-diabetic medication were 18%, with mean A1C of 7.2%. The recorded weight loss at 12 months among the innovation group was as follows. 7% lost 0 to 5 kilograms, 34% lost 5 to 10 kilograms, 57% lost 10 to 15 kilograms, and 86% lost 15 kilograms or more. The identified disparities in type 2 diabetes in the United States indicate that certain racial and ethnic minority groups with low income are disproportionately affected by type 2 diabetes. Hispanic or Latino population in the United States is considered as low income earner according to the Income and Poverty Report of the United States. The recorded poverty rate among Hispanic was for 15.7%, which is more than double compared to the non-Hispanic white with 7.3% poverty rate. Type 2 diabetes prevalence varies with the levels of education, which serves as a socioeconomic status indicator. In the year 2017 to 2018, it was reported that among the diagnosed diabetes cases of adults 18 years or older, 13.3% had less than a high school education, 9.7% with high school education, and 7.5% with more than a high school education. In 2019, the US Food and Drug Administration, FDA, approved the first pill in the class of type 2 diabetes drugs called glucagon-like peptide, or GLP-1. GLP-1 is the hormone that slows digestion and prevents the liver from producing too much glucose, which assists the pancreas to secrete more insulin. What makes this new drug special is the fact that it can be taken as a pill form and not as an injection like the other GLP-1 drugs. My recommendation to address type 2 diabetes among the Hispanic or Latino population lies on improving the knowledge of the disease among this population and reduce the incidence of obesity and outcomes. Southside Diabetes Project could be a suitable intervention program to be implemented in Hispanic or Latino communities. This innovation was built on chronic care model designed to tackle the factors that drive diabetes disparities among low-income racial minorities in South Side of Chicago. Southside Diabetes Project focuses on patients' education and empowerment, community connections to local resources for diabetes self-management, and healthcare provider training. In order to improve knowledge of the disease, the patients would receive diabetes education that is culturally tailored to the Hispanic or Latino population. Also, in emphasis of community connections to increase diabetes self-management, the patient would be encouraged to participate on hands-on skill trainings of healthy food preparations, grocery store tours, and exercise programs. While engaging in these preventive interventions, there should be an increase of diabetes screening programs that target social and cultural norms of the Hispanic or Latino population, as well as their environment. And this brings me to the end of my presentation. Thank you.